Our women's health project is on gynecologic cancers. In our group, we have Benji, Carlos, and myself, Viridiana. Gynecologic refers to the female reproductive organs involved in the sexual reproduction of human offspring, and they are located inside a woman's pelvis. The ovaries are located on each side of the uterus, and they produce egg cells. When an egg cell becomes fertilized by a male sperm, this is what grows into an embryo and eventually a baby. The uterus is the pear-shaped organ in between the ovaries, and this is where the baby grows when a woman is pregnant. This is also known as the womb. Endometrium are the layers that line the uterus, and these are the layers that shed during menstruation. They also prepare the uterus to nurture a fertilized egg. The cervix is the lower, narrow end of the uterus, and this acts as a hallway for male sperm to travel and fertilize the egg. The vagina is a hollow tube-like channel between the uterus and the outside of the body. This serves as a passageway for sexual intercourse. And lastly, the vulva is the outer part of the female genitals, and their layers protect the inner reproductive organs, but they also play a role in sexual arousal. So now, what is cancer? Cancer is a group of diseases in which abnormal cells divide out of control and are able to invade other tissues in the body. So what are cells? Cells make up our entire body and its tissues, including our skin, heart, bones, muscles, and all of our organs. These cells allow our tissues to function how they are supposed to, such as keeping our heart beating and allowing our muscles to lift something heavy. But if cancer cells take over these tissues, they will not be able to properly function. So staging cancer is based on a few things, such as the size and location of the cancerous lump or tumor, if it has spread to nearby structures, and if it has metastasized or spread to distant parts of the body. The more it has spread, the more severe the cancer is, and the more difficult it is to treat. Now the picture at the bottom left shows normal cells versus cancerous cells. Because the cells divide uncontrollably, they sometimes cause lumps and tumors, as you can see in the image. Now, putting our two terms together, gynecologic cancer is cancer of any of the organs in the female reproductive tract that we discussed in the previous slide. In the U.S. in 2022, the American Cancer Society estimates about 110,000 new cases of gynecological cancer will be diagnosed, and of those cases, there will be about 33,000 deaths. The picture at the bottom right shows a type of gynecologic cancer. It depicts a healthy ovary versus an ovary with cancer. You can see abnormal tissue growth in the cancer-filled ovary, and it also looks enlarged compared to the healthy one. There are 5 types of gynecologic cancers, and all these cancers originate in those specific locations. So ovarian cancer originates in the ovaries, uterine cancer begins in the uterus, and there are actually a few different types of uterine cancer, but we will be focusing on endometrial cancer, as that is the most common type of uterine cancer. Cervical begins in the cervix, vaginal begins in the vagina, and vulvar begins in the vulva. So here on the right side, we have a chart with some of the common signs and symptoms that you'll see for each cancer. So for cervical cancer, you might see the abnormal vaginal bleeding or discharge. Ovarian cancer, you might see a lot more signs and symptoms, such as the abnormal vaginal bleeding or discharge, feeling full too quickly or having difficulty eating, having pelvic pain or pressure, frequent or urgent need to urinate, along with some constipation, bloating, abdominal or back pain. Uterine cancer, you'll see the abnormal vaginal bleeding or pelvic pain or pressure. Vaginal cancer, you'll see the abnormal vaginal bleeding or discharge, along with that frequent or urgent need to urinate, along with some constipation. And lastly, vulvar cancer, you'll see the itching, burning, pain, or tenderness of the vulva, along with some changes in the vulva, such as rashes, sores, or warts. So we will actually be going into detail for each cancer, as they each have different risk factors, methods for diagnosing, and treatments. First, we will be discussing ovarian cancer. The American Cancer Society estimates that in the U.S. for 2022, about 19,880 women will receive a new ovarian cancer diagnosis. Of those newly diagnosed cases, about 12,810 will die from it. This is the deadliest gynecologic cancer in the U.S. Though the exact cause is unknown, we do know about the risk factors that increase the chances of it developing. So these are the risk factors on the right, and this is according to the American Cancer Society and the Center for Disease Control and Prevention, or the CDC. They include increasing age, family history of ovarian cancer, obesity, endometriosis, having a mutation in the BRCA genes, having never been pregnant or being pregnant for the first time after the age of 35, smoking, in vitro fertilization treatment or IVF, the use of hormone replacement therapy, and a personal history of breast, colon, or uterine cancer. It's important to note that having one or more of these risk factors does not mean that you will develop ovarian cancer, but it just means your risk for it possibly developing is increased. According to the CDC, signs and symptoms of ovarian cancer include pelvic or abdominal pain, frequent or urgent need to urinate, stomach bloating, digestive issues like constipation, vaginal bleeding or bloody discharge not related to menstruation or occurs after menopause, and trouble eating or loss of appetite. However, these symptoms may not present themselves in early ovarian cancer, as early ovarian cancer typically presents no symptoms at all. There is no accurate screening test available for the early detection of ovarian cancer, but for those at high risk, a combination of a pelvic examination, abdominal or transvaginal ultrasound, and screening for the CA125 tumor marker will be used to officially diagnose ovarian cancer. They may do an abdominal or transvaginal ultrasound if an ovarian mass or tumor is suspected. The CA125 marker is present in about 80% of women with ovarian cancer. It is also used to monitor the course of the disease and response to treatment. However, CA125 levels are also high in other cancers, so it is not specific to just ovarian cancer. And lastly, an exploratory laparotomy, which is a surgery that takes a look at your abdominal tissues, may also be used to establish the diagnosis and stage of the disease. Treating and managing ovarian cancer involves a few different methods. A bilateral salpingo-oophorectomy is the removal of the ovaries and fallopian tubes. It's usually done as a preventative measure in high-risk women, and it also usually involves the use of oral contraceptives, so this is to control your hormone levels that contribute to developing ovarian cancer. A total abdominal hysterectomy involves the removal of the uterus and cervix, and it is also sometimes done in conjunction with a bilateral salpingo-oophorectomy, and this can be used to treat all stages of ovarian cancer. Radiation therapy uses high doses of radiation to kill cancer cells and shrink tumors. Chemotherapy uses powerful chemicals to kill the cancer cells. Targeted therapy uses drugs or substances to identify and attack the cancer cells. So a lot of the times, these treatments will be used in combination with one another, but ultimately, treatment will be specific to each woman and their stage of ovarian cancer. Radiation, chemo, and targeted therapy will be common forms of treatment in the other gynecologic cancers as well. So just a fun fact, September is Ovarian Cancer Awareness Month, and teal is the ribbon color they use to represent ovarian cancer. So next we will be talking about uterine cancer, but specifically focusing on endometrial cancer.
Uterine cancer, which include endometrial cancer and the uterine sarcoma. Uterine sarcoma is rare and arises from myometrium. The endometrial cancer is the most common gynecological cancer. About 63,000 women are diagnosed every year, and 11,300 will die. If it diagnosed early, the survival rate over 88% is a rise from the endometrium of the uterus. Most are adenocarcinomas. The major risk factor is exposure to estrogen. The average age is 60 years old. Other risk factors include early menarche, late menopause, nulliparity, chronic tamoxifen use, previous pelvic irradiation, hypertension, diabetes. The early manifestation of endometrial cancer is abnormal uterine bleeding. Later symptoms include dysuria, dyspareunia, unintentional weight loss, and pelvic pain. There are no routine screen tests available for endometrial cancer. Most cases are diagnosed at an early stage because of the postmenopausal bleeding. The diagnoses include the patient medical history, the endometrial biopsy, transvaginal ultrasound, dilation, and curettage. Treatment: surgery, the total hysterectomy, Radiation include the external beam radiation, the brachytherapy, which is inside the uterine, protect nearby the organs such as bladder and rectum get less radiation exposure. Chemical therapy, which can shrink the tumor before surgery and prevent recurrence after surgery. Hormone therapy can lower the hormone in the body. The immunotherapy can increase the immune system, fight the cancer. The supportive care is providing relief from pain and other symptoms, improve the quality of life for the people. Cervical cancer. About 13,240 women in the United States are diagnosed with it every year. 4,100 women will die. The cervical cancer was once a common cause of cancer deaths, but right now it's better since the screen test. It's high in Hispanic women, and the mortality rate is high in Black women. The risk factors include the HPV infection, multiple sex partner, tobacco use, and have more than 3 kids, weakened immune system, the prolonged oral birth control use, the low fruit vegetable diet, the family history. At the early stage, some patients often have no symptoms. Some patients have discharge. Early is thin and watery. Later it becomes dark and full smelling. The abnormal uterine bleeding. First is like spotting. As the tumor enlarges, the bleeding becomes heavier and more frequent. Some patients have the post-coital bleeding. The later signs include pain, weight loss, anemia, cachexia. The diagnoses include the PEP test, HPV test, colposcopy, the cervical biopsy. All women should begin cervical cancer screening at age 21. The woman 21 to 29 years old should get the PEP test every 3 years. 30 to 65 years old should have the PEP test and HPV test every 5 years. The PEP test can help find the changes in cervical cells, and about 80% of cervical cancer patient is HPV positive. The picture at the bottom right shows how our HPV test is performed. Treatment. For cervical cancer, the primary management is prevention. Patient can get the HPV vaccine. It should be complete prior to the first sexual contact. Usually, patients get the vaccine at 9 to 11 years old. So other than surgery, the cryosurgery and the laser ablation for cervical precancer, the hysterectomy and the trachelectomy for invasive cervical cancer. So other include chemotherapy and radiation.
Okay, and getting into the last 2 cancers, these are 2 of the more uncommon gynecological cancers. We'll start off with the more rare of the 2. Lewis's medical surgical book states that there will be about 5,170 new cases reported annually, and that they usually occur in women ages 50 through 70. And interestingly, in a study I found published by the International Journal of Cancer by Bray and others, the cancer rates for these 2 have been steady and not growing in the US in comparison to other high-income countries. Many vaginal tumors can be secondary sites or metastases of other gynecological cancers such as cervical cancer, and about 70% are squamous cell carcinomas, which mean that they begin in the squamous epithelium of the skin. Risk factors for vaginal cancer include age, smoking, alcohol, HIV, exposure to a drug from the 40s through 70s called diethylstilbestrol. Another risk factor is vaginal adenosis, which is the presence of benign glandular epithelium in the vagina. HPV is another one, and having cervical cancer can predispose you for this cancer as well. For vulvar cancer, it is estimated that about 6,330 cancers of the vulva will be diagnosed, and about 1,560 women will die of this cancer annually. Some risk factors which are similar to the risk for vaginal cancer include HPV, age. About 20% of the women that have this are younger than 50, and about half of the women that have this are over 70. Other risk factors include smoking, having HIV, having other gynecological cancers, and having had melanoma increases the chance of developing on the vulva. Having lichen sclerosis, which is a disorder that causes vulvar skin to become thin and itchy. And lastly, having VIN, which is vulvar intraepithelial neoplasia, can increase the chances. What this is abnormal changes of the cells that cover the vulva. VIN is not cancer, but it may develop into cancer after many years. And I also forgot to mention that there is the same condition for the vagina, which is vaginal intraepithelial neoplasia. For vaginal cancer symptoms, they can be asymptomatic when it hasn't spread past the lining. When it has spread into the tissues close by, these symptoms can include pain during sex, accompanied by bleeding, abnormal discharge, and a palpable mass or lump in the area. And for advanced vaginal cancer that has spread beyond the vagina and possibly the lymph nodes, the symptoms may include painful urination, constipation, swelling of the lower extremities, and pain around the area. Diagnostic tests that can be done for vaginal cancer include getting a pap smear to collect cells from the vagina using a swab, a colposcopy, which is getting a view of the vagina and the cervix. And during this procedure, it is common to get a biopsy taken for further examination to identify what type of cancer it is. And also, different imaging tests such as a CT scan and an MRI, along with many others, will be done depending on the situation. For vulvar cancer, it is very common to have symptoms along with this cancer, and these include itching and burning that doesn't go away, pain and tenderness, particularly when urinating or having sexual intercourse, bleeding that is not from menstruation, skin changes such as color changes or thickening, a lump, a wart-like bumps, or even an open sore that is persistent. Also, per the American Cancer Society, verrucous carcinoma is a subtype invasive squamous cell vulvar cancer that can look similar to HPV genital warts. And diagnosis test for this is a vulvoscopy, which is the most popular form of diagnostic for this cancer. And this one is just examining with magnification, since the vulva is the visible outer layer of the female genitals. In conjunction to this, a biopsy is usually done to examine further, along with the same imaging test that I stated before with vaginal cancer, depending on the situation. For treatment, these cancers can be preventative to treat the neoplasias that can lead to cancer that I discussed earlier, and these include topical drugs such as fluorouracil, which is a type of topical chemotherapy that is applied directly on the vulva or the lining of the vagina. Another is laser surgery to vaporize the abnormal cells caused by the VIN. And for both of these cancers, internal and external radiation and chemotherapy are often mixed together in both of these cancers in an attempt to treat the cancer. And surgery is the main treatment for vulvar cancer in comparison to vaginal. For vaginal, it depends on the size of the cancer when it comes to surgery. For surgery for both of these, depending on where it is located and where it is spread to, it can be either a vulvectomy or a vaginectomy, which is the removal of the vagina or the vulva, whether it be partial or complete removal of the structures, or it can be a simpler excision, which would be the removal of the cancer and some tissue around it in the respective areas. A trachelectomy, which is the removal of the cervix and the vagina, is sometimes done if the vaginal cancer has spread to the cervix. And lastly, a hysterectomy or removal of the uterus may be needed if the cancer has spread there as well in conjunction to other structures. And an example of a vulvectomy is here on the slide. As you can see, for partial vulvectomy, only part of the vulva is removed in comparison to a radical vulvectomy, which the whole vulva or the outer structure of the vagina would be removed. And the same idea goes for the vagina, or the vaginectomy, I should say. To prevent the cancers discussed in this presentation, it is important for women to regularly get screened and tested by their healthcare providers to be aware of their physical well-being and to prevent problems from progressing further. For these cancers, it is especially important to get vaccinated for HPV at a young age, as you've now heard it is commonly associated with many of these cancers, as well as getting screening for any other diseases such as HIV, which can put you at risk for them. This picture is a good summary of what someone can do to prevent cancer in general and can be applied to this presentation, such as prophylactic measures to prevent cancer and surgical methods for treatment. All this education on these topics is very important for women to be able to recognize any of these symptoms that can potentially save their lives and catch cancers in their early stages, as well as knowing lifestyle choices and modifications they can make to prevent malignancies, such as limiting alcohol, smoking, and practicing safe sex. And here's a couple of the many resources related to this topic that can be found with a quick Google search. The screenshot is the CDC's website, as they have dedicated a section for resources regarding gynecological cancers, such as help on finding low-cost screening and information about cancer and prevention methods. That's the first link listed on the right. Second is the link to the American Cancer Society, which will give you a much more in-depth information about any of the procedures, screenings, surgeries that involve these cancers. And last is a cancer support group that is specifically designed for gynecological cancers, and they have people on there that you can talk to with similar situations that people with these cancers might have. And here's our references for this presentation.